So as you probably know, this is Dr. Hall. First, I want to say welcome to our office. And second, you're probably wondering why we put you in this room and you got to listen to me for about the next 10 to 12 minutes. And in large part, it's the care that we deliver in the office is a lot different, most likely, than what you've received so far. And so we found if we don't get the objective of what we do through to all the patients, then if they don't have all the information about what we do, sometimes there's a little bit of grief that we have to deal with later. So to avoid that, I'd like just to spend the next 10 or 15 minutes kind of explaining to you what the objective is of the care. Now, most people that end up in our office are suffering with some chronic problem. The most frequent thing we see is vertigo. Probably 40% of the practice is a vestibular disorder, but we see all sorts of different conditions, from MS to tinnitus, headaches, neck pain, any pain syndrome, insomnia. And really what I want to get through to you is that everybody who comes in here, there's something they're dealing with, they want to go away. And almost everybody who gets in the office first has been to multiple doctors. Usually it's the mainstream system first, and then they usually go to an acupuncturist or some alternative type care, nutrition, acupuncture, regular chiropractic, and what have you. And what you're looking for is you just want some relief. And we want that for you too. But the work that we deliver in the office, we're not specifically trying to treat any symptom. Really what we're trying to do is to find out where you have a structural problem in the upper neck, this misaligned that's interfering with the central nervous system. And if you have a structural problem in the neck at this atlas level, this is the top vertebra in the neck, inside of it is the brainstem, and it's what controls everything in your body. So if there's a misalignment at the floor of the skull, it's going to decrease your body's ability to function properly. And yes, many times those things that I just mentioned are the end result of your body not working right. So most likely prior to getting into our office, you've been to a medical doctor, they've prescribed you drugs. If you've been to a regular chiropractor, they may have given you supplements or stretching and so forth. And most of them, their goal has been to treat the symptom, right? And so I always tell patients that whether it's vertigo or headaches or neck pain, symptoms are the end result of your body not working right. And so if you're only working at the symptom level, you're not going to get rid of the cause of the problem. I think most people end up in my office, they want to get rid of the cause so their body can actually heal through the trouble. Now, the upper cervical spine isn't the cause of every single problem of every person who comes in the office, but we do find by correcting a structural problem and getting the central nervous system to work better, as the body improves function, it starts to mend and repair, and many of those problems will fall by the wayside. But I just want to make it clear that, lots of patients, they come in, they expect in one visit for all of their problems to go away. Obviously, that's not logical. So here's what we find. We find about 10% of the cases who come into the office, they're very difficult. They can take weeks and weeks and weeks for them to even say a change in the problem that they're dealing with. We find 50% of the people, within the first week, they'll have identifiable changes. And as they go through care, they just sequentially over time, they kind of up and down move out of it. I find another 10% that it does not help the problem that they came in here hoping to be helped with. And I'm not happy about that. The patient's not happy about that, but thank God it's not a very high percentage of the patients. And then there's another 10% of the people that we call the miracle cases. That's where we adjust, and within a week, sometimes 15 or 20 years of chronic problems will be 80 or 90% better. And I'm happy about that. The patient's happy about that. But we call that relief. So they've gotten relief, but the body still has to go through a healing process to fix the underlying soft tissue injury, the structural instability that's come from the injury that caused their problem in the first place. And again, most people who come here, they didn't just get injured a week ago. What's causing most people's problems who come here, because I'm the last ditch doctor, I'm not the first one they get to, they've been dealing with it for, in most cases, many years. So what I'd like to do next is I'd like to just run you through the average person's life from birth to death, what they go through, the traumas they have, symptoms that they develop from it, what they generally do with our normal healthcare system in trying to fix the problem, and then how upper cervical kind of fits into all that. When I was young in practice, I was trying to find a good way to get a global picture of what I do and the objective of what it is that we do through to the patient, and I found what I was doing wasn't working. So what I'm about to deliver to you next is just that presentation to hopefully to help you understand our objective and the long-termness of most of the problems that people are dealing with and how it takes time for the body to recover. All right, so this is what I call the global view of most of our lives and how we, generally speaking, deal with healthcare problems in this country, and how then I'm going to try and transition into how we look at healthcare and how I can help you if you decide to start care with us here. So, on bringing you back to school just temporarily, the x-axis is age. So up here in the corner is where you're born at 0, and traversing to the right side, you're getting older, 5, 10, 20, 30, 50, hopefully 100 years old. And the y-axis we call function. Now, I also have health labeled there because if you're functioning at 100%, which would be right up here, you're perfectly healthy. If everything's working right in your body, you're healthy. If you've lost 50% of function in your body, you've lost half of your health. And if you have no function in your body, obviously you're dead. So anybody who's in my office is somewhere between 100 and above 0. So let's say you're born into the world. That's right here. And we're going to say you didn't have a forceps delivery, you weren't a vacuum extraction. The reason I bring that up, when kids are delivered with those types of procedures, which is about 2 or 3% of the kids these days, is 120 pounds of force that's exerted in the neck. So we're going to say you were a natural delivery, you weren't dropped on the hospital floor, and as a consequence, there's no structural damage to the upper cervical spine, and from a neurology standpoint, from the nervous system standpoint, your body's working normally. And we'll say you start growing older and you're 7 years old. Of course, I'm making all this up, but most of us, this is our life path in some degree or another. You're 7 years old, you're a boy, you get your first BMX bike, and you make a jump with your buddies. If you're a girl, we'll say you're climbing in a tree fort and you fall outside the tree fort on your head. If you're the boy, you took a header off of the jump and landed in the concrete. So you have your first big trauma. The top vertebra in the neck structurally misaligns out of position, and you have your first irritation to the central nervous system, right? What does that do? It lowers function. So we'll start making this little graph we have here. So over 3 or 4 years, and this isn't going to be perfectly to scale, but you'll catch the drift. Your body starts not working as well as you should. Initially, you might get a sore neck, a little pressure at the back of your skull. You may get a headache once a week, but the body is young. It adapts. Eventually, after a couple of weeks, you have no symptoms. You probably don't even tell your mom, like most of us, and so you continue through the life without telling anyone. But if you were my kid, I check my kids every week. I would find that structural problem. I'd correct it so there's no irritation on the cord, so the body can continue to work the way it's supposed to. And we'll say you're 16, you get your driver's license, and you have a rear end accident. So you have the second insult into the upper cervical spine. You have your second trauma at the joint level. There's another pattern of misalignment in there. There's more irritation to the cord, which reduces function more. So when these structural problems happen, if it gets locked out of position, it doesn't fix itself. Your body adapts the best way it can, right? And so you're still young, there's not enough pressure on the cord to cause symptoms, but you're losing function, right? So we've been taught in this healthcare system, if we feel fine, don't do anything about it. If we feel bad initially, and I'm gonna get to that, we'll probably take an over-the-counter drug. If it gets really bad, we end up at our medical doctor, generally speaking. That's what I did 30 years ago. So you're now 25, you're now working at 80% of your optimum, and maybe you have a third trauma, another car accident, and you have another insult into the system, and now all of a sudden, I didn't explain one of the most important things. This dashed line here, I call the threshold of whether you have symptoms or not. So you can be working at 90% of your potential and not have symptoms. And of course, this is arbitrary, but at some point, as the function in your body decreases, at a certain level. I'm just calling it 75%. If you fall below that dashed line, you start to have symptoms. So this particular case, they're starting to have a headache once a week. They notice their energy isn't as good as it used to be. Falling to sleep at night 1 or 2 nights a week, instead of falling right to sleep, they're taking a half hour, sometimes 2 hours. They're waking up in the morning and they're not as rested as they used to be. What do most Americans do here? They drink coffee to increase their energy. If they're having headaches, they take an Advil, and they both work. They make you feel better. If you have a headache, usually you take an Advil, it goes away. And people are grateful they can keep functioning. But as most people know, that's only treating the symptom. It's not getting to the underlying reason why they have the problem. It's not addressing the structural problem that's irritating the system and causing the body not to work as well as it should. And so you go on with your married life. Your energy's better because of the coffee. You take Advil for pain. If you're having allergies, you go take some over-the-counter medication like Claritin. But if you don't address the underlying problem, and it's a big enough problem that's irritating the nervous system, it's going to continue to irritate the nervous system and continue to cause the body not to work as well as it should. And at some point, the patient has more severe chronic problems. And when we have severe chronic problems, I remember 30 years ago, you get worried. Oh my God, I'm dying of cancer. Oh my God, what's going on? It causes anxiety. And what do? We go to our healthcare provider. So we go to our doctor, they take a history, they ask you what all the symptoms are. They may take an x-ray, they may take a blood test, they may take an MRI. And then what do? They diagnose you. You have vertigo, you have Meniere's disease, you have tinnitus, you have post-concussion syndrome, depression, high blood pressure, whatever. And then instead of asking what the cause is, generally speaking, they then give you a medication to treat the symptom without ever asking what the cause is, right? So a certain percentage of these people are sick and tired of taking drugs. While they may make them feel better, they know that there's got to be a better option. And so sometimes they'll go to a nutritionist, an acupuncturist, a chiropractor. Some of them end up in my office. So the objective in this office is to find out where you have a structural interference to the nervous system. And we'll do that in a minute by running through a battery of tests. And then once we know that you have a problem where it is, we take a 3D image of the upper cervical spine to find out, and we're going to get into this when you get into the room, to find out exactly what direction you're out of alignment and what angle your joint is, and then we'll make a precise correction to get that segment clear of the cord, which then allows the body to start to work better. So you come into my office here, we get that interference removed from the cord. What does the body start to do? It starts to move towards higher function, and it will do that in a very up and down episodic fashion until it can get as close to normal health as possible. Now, if you're 90 years old and you've had a problem for 50 years in your neck, you still can do better. I've had lots of 90-year-olds improve and care, but you're not obviously going to be 20 again. The younger you are, the less time it's been there, the faster you're going to recover, the more complete the recovery is going to be. But I want to make it clear, we aren't trying to treat vertigo or any particular symptom. We're trying to correct a structural problem. And then as you go through care, you will come in regularly in the beginning to get checked to see whether that interference is there or not, with the goal being to keep that vertebra where it should be, clear of the cord, so the body can go through this healing, mending, and recovery process. Now, a couple of things I always illustrate to patients. When you first had your injury and your body started losing function, you had no symptoms. So symptoms are not the first thing that show up when your body starts having trouble. They're the last thing that show up. So when we get you corrected, your body just doesn't snap back to 100%. It's got to go through a healing, mending, and repair process, which obviously takes time. The longer you hold the adjustment, the better, and the faster you're going to get better, and the less you're going to need to see of me. So the objective is to correct the vertebral subluxation, the misalignment in the neck, to get the body to work better, check you over time. As the patient stabilizes and is holding their adjustment, we'll start to back you off of care and not see you as frequently. So back to this, as you lose function, you may have no symptoms. The last thing that shows up are symptoms. You go to the main care health system, they never ask what the cause is, they usually just treat the symptom. You come in my office, I'm gonna run you through a battery test to find how you're off. We're gonna correct you, and we're gonna check you over time, with the goal being to keep you clear so your body can move towards higher function as fast as possible. Now, if you're someone who gets in here When you've only been below that dash line for a month or two, obviously you're going to get above it much quicker than someone who's been below that dash line for 5, 10, yes, sometimes 40 years they come in here. Now, in the beginning, we'll check patients usually twice a week for 4 weeks and once a week for 8. After that 3-month care program, most of my patients are above this dash line. So they're feeling much better, which they're happy about and I'm happy about. But when I was young in practice, when people would feel better, they would drop out of care. And then I would see them 6 or 9 or 12 months later and they'd be in trouble again. So even when all the symptoms are gone, we still want to check you periodically, because once you get above this dash line and you're feeling much better, that doesn't mean all the structural problems have fixed themselves. So symptoms will clear much faster than structural problems. Structural problems take 18 to 24 months. No, I'm not going to have you in here every week for that long. No one would sign up for that. Average patient after 12 weeks, I'll have them come in 3 or 4 weeks and they'll be checked through time as they continue to recover. And then once they've stabilized and they're back to as close to this 100% line as possible, it's kind of like a dental checkup. We'll check you very periodically. So one more analogy and then I'll end. If you go to the dentist because you have crooked teeth and you get braces on 2 or 3 months, the teeth are much straighter. But if you take those braces off, the teeth will go right back to where they started. If it's been only a couple months, if you leave them on for 18 months, the correction's basically permanent. So it's much the same with upper cervical care. We want to keep you clear over time to allow the underlying structural reason that you have these problems. And not everything obviously is caused by upper neck, but a lot of the problems that people come in here with are. And if we can keep you clear over time, you're going to get us back close to health as possible. And then we just want to check you periodically to maintain it. So we'll see you in a few minutes. We'll run you through some tests, go over your history. If you have any questions about what I've said here or what I say in the room, please ask me.